So I have a difficult task because I have only 15 minutes and we just need to discuss all things about technology in diabetes care. And I just tried to restructure all my presentation, which I was just doing for months before this conference. So we will discuss some practical aspects of insulin pumped therapy because Professor Patrakeeva has an excellent presentation yesterday on that. We will talk about practical aspects of continuous glucose monitoring, have something about mobile application, about education and responsibility in technology era, and something about big data issues. Let's start from insulin pumps. I decided to put all these questions from you to this presentation. The frequency asked question there is about small children, as we remember from yesterday. It's about indication for insulin pump usage and how we can start to use insulin pump. First, about small children of young age. It's really very important to use insulin pumps in that age. And we have a good example from St. Petersburg where I'm working, because everything is for free now in this age group. So data say us that even if the children are very young, the mean age of this group was 4 years old, it's very effective. And if you will talk just some physiological issues here, you can understand that there are a lot of insulin pump benefits, like precise insulin delivery, various bolus types, temporary basals, it's possible to use it, different basal patterns, synthetic infusion set, and change it in the MDI. So it's very important to remember that we really can use it in very young children, even less than 10 years old. But if you will just move to indication of insulin pumps, there are something from ADA, the list is written here, but I think that the best indication list was written in ISPAT guideline, and now there are some conditions with recurrent severe hypoglycemia, wide fluctuation like glucose variability in this group, good metabolic control, but insulin regimens that compromises lifestyle, because we need to remember about our children and about patients first, second about diabetes. So how we can start to use insulin pump? And again, if you need any slides, you just can write me by email or I don't know how it's WhatsApp, Facebook, whatever you can, and I can send all the slides to you. Don't be shy. So we just need to know a few things. Total daily dose, it's very easy to calculate. We need to know how to split basal and bolus rates. After that, we need to divide the basal rates to 24 because there are 24 hours. And we need to know sensitivity factor and ICR with rules of 130, 350. It's very easy. Something about basal bolus split, because it's like physiology. We know exactly that usually we use 50-50 spread, but it's not for everyone. And it's written here. Sometimes we need more basal, for example, for low-carb eaters. And sometimes we need less basal, like 30%, but it's very easy to understand for what reason we can use it. As you remember, after we can just divide this and understand what's the percentage of basal rate, we need to understand at what times we need to use different boluses, different basal rates, and it's from physiology also. Our usual approach is to divide it like this, because it's physiology. You know, we need a little bit more basal rate during the early morning, after that a little bit less. So it's easy to understand. What about continuous glucose monitoring? So very frequent questions are what kind of system we should use and what are the indications. As everybody knows, we use interstitial fluid for measuring blood glucose in these situations. And the reports usually looks like that, but the question here, what type of the system we can use? It can be retrospective or professional monitoring or real-time monitoring. So it's officially we can just have Medtronic retrospective monitoring like iPro system. Or the closest days we will have Libra Pro, which will be also retrospective. And we have real-time monitoring. It's like example, which is I put here, when we really need to use the real data. For example, in some surgical occasions, like here, a cesarean section in the process, or in a situation when patients really need something. For example, if the patient has possibility to drive or to walk inside situations that we really need to use real-time monitoring. So what are the differences? I just put it in one table. So we can use in clinic personal things like real-time is for patient's usage, and it's patient's property. We can use the retrospective monitoring on demand, and continuously we can use the real-time monitoring. It's blinded information in professional, and we have alarms in real-time monitoring. So the main conclusion here that professional monitoring can give us the real information without influencing factor from patient's side. How we use it in our clinical practice, it's very easy because you just need to put the patient for 2 visits. At visit first, we just have some education about basic of CGM, calibration information, diary about self-monitoring of blood glucose, and we insert the sensor. And the second visit, after a week, we download the data, we can interpret it, and we have give recommendation to the patient. If the patient want to have printed version, we also can do it. So it's conclusion here, it's very easy to work with that, even in our outpatient clinic. It's just a simple conclusion. Do you know these guys from movies? Like superheroes. So simple question, what is the difference between them? Do you know? Do you have specialists on superheroes here? So it's easy, because Superman has really superpower. He wants to change the world, but not everybody likes him, because he's annoying. He's superpower, not real person, but always do it all around, annoying everything and everyone. But Batman, he don't really have any superpower. He's a usual man, but it's superhero for everyone. So just to compare, Batman for me is a retrospective monitoring system without any alarms, but good for everyone, even for us working in outpatient clinic. And Superman with superpowers, real-time monitoring, is not for everyone, but it can be perfect and annoying because of alarms for our patients. So what are the indications? Every situation with necessity of detailed information about glucose level, and there are some simple list therapy change of lifestyle, strict glucose control necessity condition, without increasing of hypoglycemia, for example, pregnancy, or for children, and hypoglycemia prevention. So let's move to mobile applications in diabetes care, some sort of philosophy here. We can just divide all this mobile application to 3 things: for patients, from industry, and for healthcare professions like we are. There are a lot of classification now for mobile application. You can just read it here. It's a long list of things we can do with mobile application. But really, we need to remember that if we will talk about application for patients, they can help the patient focus them to be healthier, also simplify daily diabetes management for all our patients, help encourage many self-care behaviors, and it's close to motivational issues, and empower patients also. Why is the patients are really need to do it? Because amount of information, there are a lot of everything on the internet now, it's a lot of information everywhere, and it's difficult for our patient to live in that world. But it also can help them to cooperate with us, like healthcare professionals. And I just didn't want to tell you the whole list of mobile applications for patients because it's a huge number. I just need to emphasize that there are not only a pros, but also a cons for usage of mobile application for our patients. Because first of all, it's necessary to have internet access, and that's possible for some part of the world. For example, in my country, we don't really have a nice level of internet in every region. Poor bad information in that application, it's also possible. Lack of technical support, sometimes need to synchronize data manually, so it's not very easy for our patient. From the doctor's point of view, do you use any applications for doctors? Can you just raise your hand who uses that? Oh, only one. Okay, really, thank you for this. So it's correspondence of patient data, it's possible to use some application. Time management in the office, it's easier to work on that, and it's easier to access. So why we really need to use it? Really, because it's time, and we need to worry about the time. It's progress of technologies, and that's very close. We need it in telemedicine issues, and of course it's a way to be connected with international associations. But there are also some cons here, because really, we need knowledge about how to use this mobile application and what kind of application do we need. We need to have some technological skills for this, and again, we need internet access for doing this. So why is industry interested in mobile application? It's also very easy because it adheres for some drugs or devices, its status. Of course, it's a question of money for them, and it's a patient opinion, like a reputation. And of course, it's possible to use like promotion. Like simple exams, it's a lot of mobile application for sensor, for monitoring systems. So for example, the Dexcom, it's very popular in Russia. So there are still some advantages and disadvantages, which is written here, but we need to remember that we need to use mobile applications because it's a real world. Why sometimes it's not successfully? Why not everyone just use it like here, only one person use? Because it's really some psychological issues. It's difficult to believe in new things. It's knowledge, it's social things, and too many useless applications. We have a bad experience with it. Because, if we talk about ideal application, it can be free, easy to use, number of functions, which is useful to concrete person information, engaging, and aesthetic. So it's difficult to perform it, but we still have a hope that we will have it. And if we will just summarize information about application, like take-home message, the amount of applications is huge, and it will grow for sure. It's the present, it's the future, and application for patient work successfully with the help from healthcare professionals and industry. What about education? So for healthcare professional, how can we use technology in diabetes care? Of course, a lot of data here, just one simple example. It's a study about residents, not real doctor, but close to them. Almost 100% just prefer animations and text in textbook, and they spread knowledge from this internet data with other people. So I just want to advise you two resources for doing that, like education through technology, through internet resources. It's our AASD e-learning platform. It's free. Just go to the website and do everything, whatever you want on e-learning. And the second one is it's a possibility to use technology for knowledge. It's from Diabetes Education Study Group, which is governed by Professor Florian Totti. So you can just go to the site and get free access and to have a lot of knowledge for this. What about patients? If you talk about patient education, possibility to use technology, of course it's easy because, for example, if you're talking about adolescents and young adults, we really need to remember that we need to use flexible regimen, social clubs, social media, web resources, online information, text messages, mobile application, and sometimes it helps because it's a way to have a temporal parentectomy, as we can say. So the last part is about big data. So we are living in the world of change in the paradigm of this. And of course, there are a lot of clinical trials running all over the world in parallel. There are a lot of information about patients in health database and a lot of books about it. We really have a lot of journals, articles, and so on and so forth. And there are a lot of electronic healthcare recordings. So it's a huge amount of information. So, and where and when we can use it. So of course we can use it like a digital preservation and to copy and to do this, obviously with all this data. It's possible to use it for data analysis, like decision support things, so on and so forth. So for epidemiology, because we need to have a diabetes registry, and we just only start to do this work in Russia. So for the last 5 years we're doing like a government-supported registry for diabetes patients. We can use it for research, and we can use it as algorithm. So just my suggestion for you, you just to calculate everything, to perform a registry in your countries. It will be very, very useful because we really need to use big data for our patients' care. Do we have any problems with technology in diabetes? Of course, because we need to use it according to the context, and it's not very easy every time. And there are a lot of health information which is inaccurate and misleading. So it's still some risks there, because it's some violation of privacy and confidentiality using all this mobile application, internet resources, even big data. It's overload of data. It's very difficult to use all of them. difficult to switch off mobile devices and taking time out from using them. Especially it's a truth for our young patients and for young doctors, for residents. They are living their lives inside the mobile phone and smartphone and iPads and so on and so forth. And sometimes there are some problems with technical issues. It doesn't work anymore. I cannot switch the slide. Also, some
IT. Because your time is out, probably this is. If you can please conclude in a few words, we'll be very thankful.
Sorry. So find the way. So and that will grow because we will have a lot of technology, diabetes care. But you just need to remember that we are not doctors who are going from computers or from mobile devices. We are really doctors for our real doctors for our own patients. And the very important issue is here that if you want to be successful, we need to look to the world through the patient's eyes. And it's very important to remember these words from Jean-Philippe Vassal. And we need to remember that every time we have a just person behind the number. Not only technology, iPhones, internet, or online things. We really need to remember about patients. So, as a summary, there are a number of technologies to support diabetes care. All of them, not all of them, but many of them can have positive impacts on behavior. And individuals, not only patients, but also healthcare professionals, should be adequately trained to use of these technologies. And we need really more data on that. Just to remind the take-home messages for you as a main thought for all this lecture, safe usage of technology is possible with knowledge, optimism from our side, from the patient side, understanding of patients' needs, and attention to education. Thank you for your attention.
Evgenia, this is